My name is Dr. Luigi Tullo. I'm the Vice Chair of Ambulatory Care and the Medical Director of the Division of Population Health here at the Menaces Health Network. I'm here today to talk to you about lung cancer and lung cancer screening. This is an extremely important topic because lung cancer is the #1 cause of mortality and the second most common cancer that is diagnosed. What is lung cancer? Lung cancer is an abnormal growth of cancerous cells in your lung, which is the organ that in your chest that allows you to breathe. So what are the causes and risk factor of lung cancer? Well, smoking is the leading cause of lung cancer, but not all people who have lung cancer are smokers. You can definitely get it from secondhand smoke, exposure to cancer-causing elements such as radon and asbestos. We can also have risk factors such as family history of lung cancer or patients who have had prior radiation to the chest. Finally, anyone who's had a pre-existing lung condition such as pulmonary fibrosis can also have a higher risk of lung cancer. So what are some of the signs and symptoms that should make you think that maybe you should speak to your doctor about lung cancer? Well, one is shortness of breath, feeling tired or weak, any type of lung infections that just don't go away with the normal treatment, a persistent cough, coughing up blood or a rust-colored spit or sputum, hoarseness in your voice, a lack of appetite, or an unexpected weight loss. So how is lung cancer diagnosed? Well, if you have these symptoms, you should see your provider as soon as possible. And when you go in, they will do a history and physical on you to better understand exactly what your signs and symptoms are. And then if they feel that is appropriate, they will do either a chest x-ray, a CT of your chest, or an MRI to better evaluate and see if there are any masses. If they do find the mass, then the next step would be what's called a bronchoscopy. The bronchoscopy is a tube that gets inserted through your mouth into your lungs, into the area where the mass was found, and they take a biopsy or a piece of it to be able to look under the microscope to confirm if this is cancer or not. So what happens if you have lung cancer? Can we treat it? Yes, but extremely important is that we catch this as early as possible, because the 5-year survival rate for an early cancer or a stage 1 cancer is 63%. While if we find it later on when it has now spread through your body, that drops to 8% for 5-year survival. So what can we do? Well, we can do surgery where we remove the mass. We can do something called radiation therapy, where we, through a special emitter, send radiation to that area to kill the cancer cells. If not, there is chemotherapy, where we inject chemicals into your bloodstream to allow them to go and attack and kill the cancer. And finally, there's immunotherapy, where we have developed these antibodies that, like antibodies fight other types of illnesses, go and will attack the cancer itself. So, can lung cancer be prevented? Well, it's hard to prevent, but again, if we can, the first thing to do is to stop smoking. If you don't smoke, don't start, and if you can, stop. Avoid secondhand smoke and limit your contact with other types of chemicals. What are the advantages of lung cancer screening? The advantages is doing these tests, doing this low-dose CT, as we see right here, this CT scanner, will be able to pick up the cancer as early as possible, when the treatments that we have will best be able to help you cure or at least aggressively treat the cancer. So coming in, that's really important. Finally, who are the people who qualify for lung cancer screening? Well, it's anyone between the age of 50 and 80 years of age, anyone who has smoked more than 20 pack years. A pack year is the number of years you smoke times the number of packs you smoke a day. For example, someone who smoked for 20 years, 2 packs a day, will have a 40-pack year history. So if you're greater than 20 packs a year and you have, or you're a current smoker or have quit within the past 15 years, you qualify for the low-dose CT. So what should you do if you feel like you're at high risk? Reach out to your clinician, to your primary care provider, talk to them about the cancer screening. If you don't have a PCP, you can reach out to us at 718-206-LUNG or at the email lungcancerscreening@jhmc.org, and we can set you up with a primary care provider and get you set up for a CAT scan. So please think about this, and we are here to assist you.